Welcome to BW Healthcare World. My name is Harbinder Narula, and my guest today is Meena Ganesh, the Chairperson and Non-Executive Director of Portea. She started Portea after exiting Tutor Vista by selling it to Pearson's. Being a pioneer in the home healthcare space, they have paved way not only for the industry growth, but for many other players who are aggressively looking at this sector. Let's speak to Meena ji to understand how did they identify this sector? How has the journey been in organizing something that existed but in an unorganized manner? Welcome, Meena ji. Let me straight away deep dive into the questions regarding Portea. Now, out of hospital care has always existed. We've always had people getting nurses at home or caretakers for their loved ones who are either unwell or aged. But how did you think of organizing this space and start Portea? What was that trigger?
Yeah, that's a very good question, Harbinder, and thank you for, firstly, thank you for having me on the show. In 2013, after I exited from Tutor Vista, which we had sold to Pearson, I was looking at what are the other areas which require transformation, disruption, and so on. And healthcare has always been close to my heart. So I was looking at what are the various spaces in healthcare that need further investments. It was very clear that the facility-based care, be it clinic, be it hospital, be it different models in which they were coming up, those had, there's a lot of investment and a lot of progress in that. But outside of hospital healthcare was not something which was given much attention to. Even though, like you rightly said, that this is something which is a supremely important part of the entire healthcare ecosystem. Globally, it is a very large component. But in India, it was just sort of being done under the radar. Maybe family members were assisting. Maybe people who are not qualified, people who are not recognized, people who are not monitored, were doing something, and we were sort of keeping up with it. But that's not the right answer, because 70% of healthcare spends of people were indeed being spent outside of hospital, and there was nothing which was available to support them. So that gave me the motivation to get this started. And personally, I had also experienced this myself. I had managed the healthcare needs of my elderly parents, and I had found that hospital care was great, but after that there was nothing. And it was a real challenge to get something suitable for them so that they could be cared appropriately. So all of those led me to look at this more seriously. And it took about 6 months of deep research, talking to people across the industry to understand what we have to do. And then this got started.
Now, you pioneered this particular organized aspect of this particular industry. Now, after you got into this business, people saw the opportunity, observed it, noticed it, and there are a lot of new players who entered into the industry. How big is the current estimate of the market size, and how do you see it expand?
Yeah, sure. Well, it's a very good question. While the market is huge, it's about $5 billion is the estimate of the outside of a hospital healthcare market. Probably about 3 to 4% is in the organized sector today, even today, after the last 7-8 years of hard work that some of us have done. The whole market is growing at about 17% CAGR, but the organized sector is growing at more than 30% CAGR, because there is an opportunity there. There are people are now realizing the importance of this care, and there are different parts of the ecosystem which have understood this and have come in, and which is leading to the growth of this organized home health care. First is the patients themselves, and they are the most important part of the ecosystem. There is a great realization that it is not enough to just get care at the hospital, but you need to have probably ongoing care for different types of patients and different demographic profiles, where starting from primary care to chronic disease management to post-hospitalization to elder care. In all these segments, there's a very clear realization that hospital care provides only part of the overall solution. There is also, post-COVID, people have taken a lot more of interest in their own healthcare. and they're taking charge of it, and they realize that they need to be on top of this, which means that they're looking at various modalities, whether it is digital care or care at home, self-care, using devices. All of these have come into the fore. But that, keeping that aside, just the core healthcare, and some of that are fads, some of those are good things to have, but even for the core things which are necessary to have. For instance, somebody is in a hospital. Okay, just before that, just taking one step back, 65% of healthcare spends today are outside of a hospital, are out of pocket. So we are paying out of a pocket. It's not insurance, it's not government paid and all. So when you're paying out of your pocket, you want to find the best and the most efficient way of getting healthcare. So in that context, when you look at something like ICU setup at home versus ICU setup at hospital, for a patient who is stable, it is nearly 60 to 70% cheaper to set up the same kind of care at home. And this is true for various other things. For chronic diseases, you cannot be treated at a hospital ongoing. You can probably do a few things in the hospital, but when you have to continue to take that care, it has to be at home. For everything, if you go back to the hospital, the costs balloon, especially when you're going outside of, if you're doing out of pocket, it's coming out of your own pocket, the motivation to take the care at the right place is even more important. So that is one thing which is transformation which is happening. The other thing is amongst the hospital fraternity themselves, there is a lot of interest in managing the continuum of care, because people come to a hospital for specific things. After that, there's a huge gap.
But out of this organized sector, the percentage of the total market size that you mentioned, what is the share of Portea?
Well, those are not numbers that I am permitted to share, but of course you can look up market reports and find out. But we are definitely the leader in this by a significant margin. That's about it.
Got it. So, you already mentioned that setting up an ICU at home or home care is cheaper than providing the services in the hospital.
Correct.
Right? What are the trends that you have seen after COVID that, the acceptability of home care, has it gone up, and has it changed the mindset of the receivers as well as the care seekers at home?
Absolutely right. During COVID, especially wave 2, as you I'm sure recall, hospital beds are completely jammed with COVID patients, and both hospitals and patients struggled to provide and get any care for non-COVID situations. So that, and also a lot of the COVID care and even critical COVID care had to move to home because of the situation. I'm sure all of us recall that. So all of that has given patients and hospitals clarity that it is important to have both these facilities available. You need to be able to care in the hospital for things which need caring at hospital, and those which can be cared at home, you need to get to care at home. Now, what this has done is not just moved the simpler procedures home, but also some of the more complex things. For instance, like I said, setting up an ICU at home for a stable patient is now something which hospitals and patients both look forward to, because there are multiple benefits of that. For one, as far as hospitals are concerned, their beds are free to cater for patients who are sicker, who are not stable, and who need absolute continuous 24/7 monitoring in a hospital environment. Right. Secondly, there are hospital-borne diseases, infections that we all know are the biggest reason for mortality amongst ICU patients. So that's another reason. Third is, of course, it's cheaper on the pocket, and fourth, it's better for the patients to be part of within their family, to be cared for by their family members. So all of these are reasons why some of these are moving. But even certain other conditions, like providing chemotherapy for a cancer patient, after the first 2 cycles, the balance cycles can actually be now delivered at home, dialysis at home. So these are procedures which were only hospital are now partially hospital, partially home. But that said, hospitals are realizing, like I was starting to say earlier, that when a patient goes through a certain procedure, the entire recovery is not going to happen while at hospital. A lot of the recovery process happens at home. And unless that is monitored and is delivered at the right quality and in the right format, the entire recovery doesn't happen as expected. And of course, that reflects back on the hospital. You go to a hospital for a surgery or for a procedure. If the recovery doesn't happen, even for your own fault, you will still go and say that hospital did not give me the right outcome. So it is in the interest of the hospital and, of course, in the patient that this continuum of care is maintained with experienced, qualified, monitored home care.
Meenaji, now this is what you're offering is a very specific service and it requires a lot of care beyond just the healthcare training that is received because there's a lot of soft skills, etc., that come into it. What has been the biggest challenge for you when you that you face as a home care healthcare provider?
So you're right that this is a highly manpower intensive business, as is the entire healthcare industry. So it's not something which is special for outside of hospital healthcare. All of healthcare is highly manpower and skill dependent. So it is very critical for all of us to find pockets from which we can recruit the right kind of people, train them for the additional skills that they require to service patients at home. And third, also have the right monitoring mechanism, especially because they are not sitting inside a facility. They are providing these services at a patient's home. Having the right technology to monitor what is going on at home, to have the right devices to maybe capture the data, give a lot of control to the patients and the family to feedback to us and tell us what's going on. All of this becomes important. So from day one, for instance, we have invested in creating a platform for all our patients and our caregivers and our healthcare professionals to use apps, to use our technology to know what is going on, to track what is going on, where is the caregiver, have they reached the home, have they started the process, they have to capture certain data and that. So all of that becomes part of a large ERP that we have created, and that becomes important as well. Additionally, there are quality standards that have been specifically created for this particular industry. Along with QAI, some of us leaders in the home healthcare sector, we've created the QAI standards for home care industry, and all of us, some of us are accredited for that as well. And that ensures that we monitor and maintain a certain level of quality for delivery, just like hospitals and labs have to do.
Meeraji, we have seen a lot of technology advancement that has happened in healthcare. And one of the things that has changed is that there is a lot of reduction in the size of the equipment that is there. There are these small handheld ECG devices, monitoring devices. Has that changed the quality and the access to healthcare at home? And also, has it empowered companies like Portea to connect with the hospitals so that it is not just the monitoring but also immediate attention which is provided to the patient?
Absolutely right. Technology has improved quite a bit, ranging from simple wearables that all of us now sport, which track various parameters, to medical grade devices which track parameters of patients in real time and which can be seen by our own control centers, as well as we can share it with the hospitals and doctors, and their control centers can see as well. This has certainly come in, and it will help in times to come. I wouldn't say that it has transformed yet, because still there's a reluctance amongst the patients also to say that we will replace a human with a human who's monitoring with a device that is monitoring. And they will treat the two as equivalent care. That I don't think we've come to that. So it will always be a human with supported by some device. And so it's a journey. I think there is a lot of movement and a lot of excitement in this area for sure.
Meenaji, you had mentioned that your business is dependent on manpower. It's a manpower intensive business. So how easy is it to find quality and trained manpower and trusted manpower for the kind of services that you provide?
It is always a challenge, and in healthcare industry, manpower has always been a challenge, and it's not something which is unique to us. However, because we've been an incumbent here for the last 9 years now, and we have connects with various pockets from which we can recruit manpower for caregiving, for qualified nurses, physiotherapists, doctors, phlebotomists. So we have created our channels of recruitment. But having said that, when they come in, we still have to do our top-up training for anywhere between a week to 2 weeks, depending on the kind of roles that people play, so that they're able to not just do the right thing that is expected of them, but also they know our processes and our technologies and are comfortable using those while managing our patients.
Uh, you had mentioned that hospitals are seeing a lot of value in home healthcare because it's a continual treatment for them as well. And since the industry is growing, do you see that these hospitals are wanting to partner with companies like yours, or are they willing to or wanting to expand on their own as a logical extension for them? What is the trend that you are seeing or the sense that you're getting?
So one thing is very clear that hospitals are now much more keen to get home care as a part of their overall offering. It wasn't the case 8 years back, 9 years back when we started. So it was a lot. There was a lot of evangelization that we had to do for the need for home care. That obviously has changed drastically, and everybody believes that home care is a part of the overall offering, and they need to make the right decisions on how to provide it. Now, there are a few hospitals which have taken it upon themselves to do this on their own. But most of the hospitals that we talk to find that this is a very different kind of a business. This the DNA that is required to run an outside of hospital healthcare business is very different than running a hospital and in between trying to send your nurses out to provide support to your patients. And even those hospitals which have got their own home care units still find it worthwhile to work with specialists in areas where they feel that they are either geographically they're not covering or service wise they're not covering, or like in our case we provide a combination of services and medical equipment. So for everything that we do, whatever is the medical equipment required, beds, monitors, respiratory equipment, DVT pumps, what have you, all of that goes as a full solution. And many hospitals who may have some nurses, they don't necessarily want to create an inventory of this and then manage that inventory. So they then say, okay, you send your equipment, we'll send our nurses, we have that as well. Or they say, we only cover this geography, can you cover the other geographies for us, because we are present in 40 locations, so it becomes easier for them. So all of this leads to a degree of cooperation, even for those who decide to work on their own. However, majority of them feel that it makes sense to work with specialists in this area.
Got it. Ma'am, since you mentioned geographies, now where all are you present? Are you only present in the major cities, or you have plans to go into tier 2, tier 3 as well? Because if you look at it, there's a huge purchasing power among tier 2s.
So you're absolutely right. Yes, the growth in economy of the tier 2 cities is substantial, and the healthcare presence in those cities has still not come up to the mark and as it is in the large urban centers. And the interesting thing is that a lot of hospitals are also doing exactly that. Their growth is coming out of the tier 2 cities and maybe even in tier 3, because they find that those are the places where there is still a lot of unmet demand. And the same thing, and wherever there is hospital care, there is outside of hospital care, and there is a need for both of those to go together. So you're absolutely right that there is a lot of interest and demand in those cities, and we are seeing good traction in the new cities that we have launched.
Ma'am, senior care has emerged very recently, and it is also getting organized. And to a large extent, it seems like a subset of out of hospital care. Now, how is home health care different from senior care, and what is your interest in that particular segment?
So you're right that home healthcare has been catering to a large extent to the senior citizens and senior population. And about 50% of maybe more than 50% of our customer base are elders who have either chronic conditions or who have regular healthcare needs, and they need to be monitored for health. They need caregiving and so on. So we come into looking after seniors from a healthcare perspective. But the senior care requirements may go beyond that to helping them with their finances, with their bill paying, with grocery shopping, what have you. So a senior care solution, which is focusing only on that industry, may have a combination of healthcare and non-healthcare requirements as well. Plus, senior care is not just care at home. That I think they're also looking at how care can be provided in facilities, and not the old age homes of yore, which were unfortunately very poor quality. But these year they're talking about where retirement communities plus, and as people go become sicker, then there's sick care also available in the retirement communities. Both of these are important. I think while retirement communities and facility-based care for seniors may also grow, the caring for people at home is going to continue to remain the mainstay. In fact, globally, senior care centers are seeing a decline, especially after COVID, and people are preferring to stay at home because some of the senior care centers globally lot of COVID issues. And so now people are preferring that would they like to. So COVID is only one reason. It's also that people are preferring to retire and probably spend the rest of their sunset years in a place where they're familiar with people they're familiar with. So that's so there is a slight movement backwards to home care in the global market. In India, the facility-based care is yet to catch up. So it certainly has a big role to play in senior care.
When you look at providing your manpower that is actually offering healthcare at home, one is that certain patients may be having specific conditions, but they're also suffering from dementia, etc. So, do you have specifically trained manpower that is able to manage this? And my second question alongside is that one is when you look at this particular services, the security issues that come up of having the trusted manpower being provided, but the other aspect is the security of the manpower that is going. So how do you handle these things?
Yeah. So you're right that there is a huge increase in the number of people, elders who have some sort of dementia or some sort of cognitive decline. And a lot of our health caregivers do work very closely with such patients, and we have been able to manage quite a few of them. Of course, if the conditions are beyond managing at home, in that case, they have to go to a facility. But that said, most people we are able to manage and support at home with the caregiving and with the support with the healthcare workers that we have. And many of them have now got years of experience managing people with cognitive decline. So we do have the ability to do that. Now, talking about the second point about security of patient, security of caregivers, this is a very important aspect. And from day one, we've been we really have focused a lot on this, both in terms of ensuring that we do background checks for our people. Likewise, we also send our coordinators to check out the family and their circumstances to see, will we feel comfortable to have our caregivers there and our healthcare workers staying there. And we also have a very close monitoring thereafter, even after deploying, to ensure that both the caregivers and the patients are feeling comfortable with each other. And there's an open communication that is channel maintained, so that we know if there's anything which is not as per expectation.
My last question to you is the impact of insurance. I mean, we are in an environment where you need to be hospitalized to be able to claim insurance. And insurance is a very important aspect of any growth of healthcare services. So what is your view on this and what is your expectation?
Yeah, that's a good question. And I think post-COVID, there has been a lot of interest in the insurance sector, and we are working along with Nat Health and the insurance community there to see how we can get more and more outside of hospital care covered by insurance. Some of the early policies have been released by Star Health and ICICI and Aditya Birla. Few of them have started to come out with policies which do cover home care as well. And we are working with them to see how we can further expand this and make it easier for patients to get care both at hospital and outside of hospital.
Meena ji, thank you so much for your time. It has been such a pleasure talking to you, and we wish the best for Portea. Thank you so much.
Thank you very much. Thank you.